In today's class, let us try to understand about carbamazepine. Okay, this is another important anti-epileptic drug. See, before starting about this drug, let me tell you few important points to remember about carbamazepine. First, very important point about carbamazepine. As we already know, carbamazepine is an anti-epileptic drug. Okay, it is used in epilepsy. First point, it is anti-epileptic drug. Number two, carbamazepine is enzyme inducer. Carbamazepine is enzyme inducer, same like phenytoin, enzyme inducer. This is second important point. Okay, see, in enzyme inducers in previous classes we have seen crab gps. C, carbamazepine. C starts with carbamazepine. Okay, R, rifampicin. A, alcohol. P, phenytoin. G, glycofulvin. P, again another P is phenobarbital. And S is sulfonylureas. So these are the potentially enzyme inducing drugs. Always remember, in this C is carbamazepine. So second important point about carbamazepine is enzyme inducer. This carbamazepine will induce the cytochrome P450 enzymes in the liver, and this what it does, it will metabolize the other drugs which are given along with carbamazepine. All those drug interactions we will discuss in detail. And third important point, yaad rakh lo, very important point, carbamazepine will release anti-diuretic hormone. This is important point. Third important point, carbamazepine releases or it induces release of anti-diuretic hormone. The anti-diuretic hormone is also called vasopressin. Okay, this is very important point. About this significance I'll explain in next slides. And next important point is carbamazepine will cause aplastic anemia. It will cause aplastic anemia, very important adverse effect. Aplastic anemia, along with this it has many other adverse effects, but this is important one, so you should not forget it causes aplastic anemia. And next important, another fifth last important point, carbamazepine is not only used in it is not only used in epilepsy, it can be used in mania. Okay, acute mania. Mania is hyperactive condition. Mania, it can be used in mania and also in bipolar disorder. Okay, and along with mania and bipolar disorder, it is given in diabetes insipidus. This is another important point. Diabetes insipidus is the condition where patient will have excessive urination due to deficiency of vasopressin. Vasopressin deficiency condition में diabetes insipidus होगा. And here what I told, carbamazepine will cause release of antidiuretic hormone vasopressin. That's why it can be used in diabetes insipidus. So remember these 5 points about carbamazepine. Now let us discuss about carbamazepine in detail. I will tell you one by one. See, in previous classes already we have discussed this classification. Carbamazepine will come in iminostilbenes. Okay, iminostilbene class. This is the chemical classification. In previous classes we have discussed carbamazepine is categorized under iminostilbenes. Okay, before understanding about this carbamazepine, let us first understand what is iminostilbene. Why carbamazepine is considered as iminostilbene? See, few basic structures and chemical molecule structures we will understand. See, this molecule is called azepine. This is the core structure in carbamazepine. Okay, when this azepine is added with two benzene rings, one benzene ring here and one benzene ring here. So what it forms? It forms dibenzazepine. In azepine, when two benzene rings are added, it will form dibenzazepine, which is called iminostilbene. This iminostilbene is the raw molecule which is helpful for synthesizing carbamazepine. So carbamazepine is obtained from iminostilbene. That's why carbamazepine is included in iminostilbene. I think you understood why carbamazepine is named as iminostilbene class. Actually, this iminostilbene is interacted when it is interacted with COCl2 and ammonia. When iminostilbene is interacted with COCl2 and ammonia, it will form carbamazepine. Simple. This carbamazepine chemical structure is 5H dibenzo. We have two benzene rings. Dibenzo. This is azepine. Dibenzoazepine carboxamide. This is carboxamide. So the chemical name of carbamazepine is 5-dibenzoazepine 5-carboxamide. Okay. So this is the basic chemical structures and synthesis of carbamazepine. Just for understanding, I am telling all these things. Now you see, Few other important points let us discuss about carbamazepine. First point, carbamazepine is the first line drug in tonic clonic seizures and in some partial seizures. It can be used as first line drug in most of the seizure conditions. Same like phenytoin, it is not indicated in absence seizures. Same, carbamazepine can be used in tonic, clonic, especially in clonic. In previous classes we discussed what is tonic seizure, what is clonic seizure, what is tonic and clonic seizure, what is myoclonic seizure, myoclonic, okay, what is partial seizure and what is generalized seizure. We have seen partial seizures are also called focal seizures. Okay, in focal seizures we have simple and complex. In simple means consciousness is there, complex means consciousness is absent. Okay, anyways, chalo. So carbamazepine is used in most of the convulsions, but it is not suggested in absence seizures. This is important point. Same like phenytoin. Okay, now mechanism of action, in previous class I already told you, same like phenytoin, same like phenytoin and phosphenitoin, carbamazepine is also included in the same class. This carbamazepine binds to the voltage gated sodium channels, and what it does, it will stop the entry of sodium into the voltage gated sodium channels, and with that it will inhibit the generation of repetitive action potentials, and to that it will stop seizures. This mechanism is very similar to phenytoin, so it is not necessary, it is not required to study in detail. Okay, same mechanism like phenytoin. Clear? Now you see we have some tablet forms of carbamazepine, usually 100 mg, 200 mg tablets are available. Remember, tegretol is very common and important brand, widely used brand as carbamazepine is tegretol. You should remember this. Tegretol means carbamazepine. Yaad rakh lo. This is the chemical structure as we have seen, and these are some other tablet forms. Now let us try to see the pharmacokinetics. Very important. I think you all are following me. In pharmacokinetics, yes, we'll discuss about absorption, distribution, metabolism, and in kinetics we'll discuss about absorption. Chalo. See, same like phenytoin, carbamazepine will be absorbed through oral route. When it is taken through oral route, it will be absorbed from GI tract slowly, same like phenytoin. But here, one thing you should remember, in empty stomach, it will be absorbed rapidly, and when it is taken along with food or after food, absorption is slow. This point you should remember. Okay, absorption is slightly high in empty stomach, and absorption is slow in when it is taken along with food. This is important point. Immediately after absorption, it will be distributed in most tissues. हर एक टिश्यू में distribute हो जाता. Plasma protein binding is roughly around 70 to 80%, not like phenytoin. Phenytoin is having more plasma binding capacity, but for carbamazepine it is not like phenytoin. 70 to 80% is absorbed in the plasma proteins. And one important point you should remember, carbamazepine travels blood-brain barrier. It can cross blood-brain barrier and it will reach into the cerebrospinal fluid. This is important point. And in metabolism, carbamazepine is metabolized into 4 to 5 different types, and the metabolic end products are excreted through urine. I will explain about this metabolism. Here you should concentrate, this is important. And the metabolic end products are excreted through urine. Okay, in excretion it will not follow any of the kinetics. Okay, it is commonly excreted. Now you see, this is the structure of carbamazepine, right? We have to learn this metabolic reactions. This is metabolism. See, you have to remember, carbamazepine is metabolized in 4 different methods. This is number 1, number 2, 3 and 4. These are 4 different methods through which carbamazepine is metabolized. Okay, first method is the major method. 90% of the carbamazepine is metabolized in this manner. First, what happens, the carbamazepine is converted, or it is metabolized into carbamazepine epoxide. This metabolite, carbamazepine epoxide, this metabolite is having activity. This metabolite is having same actions like carbamazepine. Actually, see, when drug is metabolized, the metabolic end product should not have pharmacological action, right? But this carbamazepine, when it is converted into carbamazepine epoxide, this is intermediate product. This is the metabolic product. This metabolic product will have actions same like carbamazepine. It is active metabolite, which is called active metabolite. This active metabolite, again, it will be metabolized further into carbamazepine diol. So these will not have action, and this carbamazepine diol will be excreted through urine. These also excretes through urine. This can be excreted through urine. This also excretes through urine, but this will again convert into carbamazepine diol. This is first method, or this is one method of metabolism. Second method is carbamazepine directly metabolizes into 10,11 dihydrocarbamazepine. This is the metabolic waste product, end product. This will not have any action, and it will be excreted through urine. This is second method of metabolism. And third method is Carbamazepine directly converts into 10 hydroxy carbamazepine. Even this is also metabolic waste product, end product. It will be excreted through urine. And the fourth method is carbamazepine directly metabolizes into 3 hydroxy carbamazepine. Even this is also metabolic waste product. So these are different ways carbamazepine can be metabolized. In carbamazepine can be metabolized through this manner, it can be metabolized through this manner here. So all these methods are performed by different enzymes. For this method we need some enzymes. Here I didn't mention any enzyme name, but all these methods are performed by different enzymes. All enzymes are cytochrome P450 enzymes. Okay, so these are different ways carbamazepine can be metabolized. Okay, you have to remember majority of carbamazepine is metabolized through this manner. That's why this carbamazepine epoxide, it will have pharmacological actions. This metabolite is active one, active metabolite bolte हैं इसको. Okay, so this is about metabolism. Now let us discuss the adverse effects. This is important. Same like phenytoin. In phenytoin, we remembered about the hirsutism, hypertrophy of gums, okay, hypersensitive reactions, hyperglycemia. All H we have understood about phenytoin, no? In the same way, in carbamazepine, there are very few adverse effects. You have to remember all the adverse effects are very, very important. First adverse effect of carbamazepine, carbamazepine causes drowsiness. Actually, phenytoin was not having drowsiness action. Carbamazepine has drowsiness action. This due to drowsiness, most of the patients who are having epilepsy, who are doing some activities like driving activities, or who are maintaining the machineries, for those patients carbamazepine is not generally suggested. Okay, night time usually we give, and night driver जो भी है उनको नहीं देते ज़्यादा, because they will have drowsiness. So this is CNS action on central nervous system. Carbamazepine causes drowsiness, and in CNS, same like phenytoin, it causes vertigo. Patient stability decreases, it causes ataxia. यहाँ पे stability नहीं रहता patient को, and sometimes blurred vision. So these are central nervous system adverse effects. Next, in GI system, in GI tract, it causes nausea and vomiting, same like phenytoin. In phenytoin, what we do to decrease nausea and vomiting, we usually suggest phenytoin after food. Here same carbamazepine also given after food to decrease nausea and vomiting. Okay, next, it causes hypersensitivity, same like phenytoin, hypersensitivity. This is important. See, in hypersensitivity, carbamazepine is the very, very important drug which induces systemic lupus erythematosus. Actually, systemic lupus erythematosus is one of the autoimmune allergic condition, systemic allergic condition. This SLE has many causes, and it is a multifactorial disease, same like psoriasis. So here in this SLE, carbamazepine plays very important role. SLE का main cause क्या है? Overuse of carbamazepine. So carbamazepine may induce SLE. This is important point you have to remember. And H, anyways, it was very similar to phenytoin. Another H you have to remember with carbamazepine also, it causes hepatitis. Same like other antibiotics and other chemotherapeutic drugs. Okay, it causes hepatitis. Most of the chemotherapeutic drugs will cause hepatitis. Here carbamazepine will cause hepatitis. Okay, and another very, very important adverse effect is it causes bone marrow suppression. It causes bone marrow suppression. Due to bone marrow suppression, what will happen? Due to bone marrow suppression, what will happen? It will cause neutropenia. It will cause anemia. Anemia, especially the anemia which is caused due to bone marrow suppression is aplastic anemia. aplastic anemia बोलते. Bone marrow suppression की वजह से अगर किसी को anemia हुआ है, that is called aplastic anemia. Aplastic anemia can be seen with chloramphenicol. It can be seen with all immunosuppressive drugs. It can be seen with carbamazepine. It can be seen with phenytoin. Okay, and it also causes agranulocytosis. Bone marrow suppression से agranulocytosis. What is agranulocytosis? What is agranulocytosis? The white blood cells, granulocytes बोलते हैं, white blood cells are drastically decreased. Okay, न्यूट्रोपिनिया में न्यूट्रोफिल्स कम हो जाते हैं. agranulocytosis में granulocytes पूरे के पूरे कम हो जाते हैं. That is called agranulocytosis. A means absence of granulocytes. That is due to bone marrow suppression. Okay, bone marrow suppression, hepatitis, hypersensitivity, nausea, vomiting, in central nervous system, vertigo, ataxia, drowsiness. These are important adverse effects which are seen with carbamazepine. Clear? Now we have discussed the kinetics and adverse effects. Now we'll see some uses. As we have discussed, carbamazepine can be used in epilepsy. Epilepsy means it is used in generalized tonic clonic seizures. It is used in myoclonic seizures. It is used in partial seizures. Okay, ये सब में दे सकते. And it is not used in absence seizures. Same like phenytoin. You have to remember this. Along with epilepsy, along with epilepsy. It is used in neuropathies. Neuropathy. In which kind of neuropathy? In yesterday's class, I explained you trigeminal neuralgia. Trigeminal neuralgia. It is used in trigeminal neuralgia. Same like phenytoin. And remember, सब लोग ध्यान से सुनो, नायक सर बोल रहे थे it is used in neuropathy, but it is strictly contraindicated in diabetic neuropathy, because in diabetic neuropathy it has no role. It is not suggested in diabetic neuropathy, but it can be given in trigeminal neuralgia. Some neuropathy दूसरे other than diabetic neuropathy, it can be used in different other neuropathies. Okay, and one more important point, what I told, it can be used in mania. It can be used in what? Diabetes insipidus. Why? Because this carbamazepine is causing water retention due to release of ADH. Okay, it is inducing release of ADH. That's why it can be used in diabetes insipidus. Now you see, you know what is ADH के बारे में आप लोगों को याद है? Do you remember or not? See, ADH is vasopressin, right? ADH is vasopressin. Now let me tell you some basic points about vasopressin. Remember, ध्यान से सुनो सब लोग. See, vasopressin acts on different vasopressin receptors. We have vasopressin 1, vasopressin 2, and vasopressin 3, which are called V1, V2, V3. These are three vasopressin receptors. V1 receptor is present on blood vessels. When V1 receptor is activated with vasopressin on blood vessels, it will cause vasoconstriction. On GI tract, it increases peristaltic movement. On liver, it causes glycogenolysis. And on platelets, it causes platelet aggregation. Very important. And on CNS system, it will release ACTH, and further it will cause release of adrenaline, which will induce flight or fight response. See, do you know vasopressin is released especially in hemorrhagic condition? Do you know vasopressin is released in severe dehydration? Whenever patient had road traffic accidents, whenever patient had accidents and severe hemorrhage, in that conditions vasopressin is released from posterior pituitary. याद रख लो. In pituitary, we have anterior pituitary, posterior pituitary. In previous class, I explained you. Posterior pituitary vasopressin is released. And see, especially in hemorrhagic conditions, what vasopressin does? Vasopressin will cause vasoconstriction. It will stop hemorrhage. And on platelets, it will stop bleeding due to platelet aggregation. So this V1 action is required in severe hemorrhagic condition. And V2 receptors are present in renal tubules and vascular endothelium. Renal tubules, again, they will increase the reabsorption of water, because here in hemorrhage and in dehydration, water is lost. So to preserve water, V2 receptor, what it does, it will increase the reabsorption. And again, on vascular endothelium, V2 receptors are present on vascular endothelium. This is blood vessel. In the blood vessel, we have endothelial epithelial tissue. In this epithelial tissue, V2 receptors are present. When V2 receptor is activated, it will release clotting factor 8 and 1 Willebrand's factor. These two factors will again increase coagulation. So V1 receptor and V2 receptor, these both receptor, when they are activated, they are potentiating coagulation and they are helping in reducing bleeding. Vasopressin bleeding condition में यूज करते हैं, याद रख लो. Vasopressin dehydration condition में यूज होता. Vasopressin hypotension में यूज होगा. All these are important points. And V3 receptor, again, V3 receptor is present on anterior pituitary and it will help in releasing ACTH, prolactin and endorphins. Endorphins pain कम करेगा. And vasopressin also acts on uterus. On uterus, it causes contraction of smooth muscles. Okay, by increasing oxytocin receptors. So this is important point you have to remember about. Actually, carbamazepine and vasopressin has great importance. Carbamazepine is inducing release of vasopressin. Clear, everybody? These already we have seen in previous class. Now, what else left? We have discussed important points. We have discussed kinetics. We have seen the importance of carbamazepine. ADRs we have seen, and we have seen uses. Okay, and yes, we have seen the relationship with carbamazepine and vasopressin. Okay, and next, yes, after carbamazepine, let us understand about oxcarbazepine. Okay, in previous class we discussed about phenytoin and oxyphenytoin. Okay, phosphenityne. In the same way, we have carbamazepine and oxcarbazepine. See, same like phosphenityne, oxcarbazepine is a prodrug. First of all, oxcarbazepine is the analog of carbamazepine. Mechanism of action, its adverse effects, everything is very similar to carbamazepine. One difference is it is a prodrug. Okay, and here in metabolism, I forgot to tell you, carbamazepine has high enzyme inducing property, right? But oxcarbazepine is having less enzyme inducing property. This is important point you have to remember. And it has very less interactions. and it has less hepatotoxic property than carbamazepine. That's why most of the cases wherever carbamazepine is suggested, in those conditions we have to opt oxcarbazepine, because oxcarbazepine is having advantages over carbamazepine in reducing enzyme inducing property, and it has less hepatotoxic property. And yeah, these two are important things. Okay, now let us see the drug interactions. Last slide, this is drug interactions. Drug interactions with carbamazepine. Actually, carbamazepine has no drug interactions in absorption, it has no drug interactions in distribution and in excretion. It has drug interactions in metabolism. Metabolic drug interactions, these are called pharmacokinetic drug interactions. And in pharmacodynamic drug interactions, it has synergistic effect with other anti-epileptic drugs, it has synergistic effect with other sedatives. If carbamazepine is given along with barbiturates or benzodiazepines, what happens? Sedative property increases. When it is given with other anti-epileptic drugs, it can enhance the activity in decreasing seizures. That is pharmacodynamic drug interaction. Okay, now let us focus on pharmacokinetic drug interactions, especially in metabolism. Same like phenytoin, carbamazepine is enzyme inducer. It is enzyme inducer, right? So when carbamazepine is given along with, we have some examples, valproic acid, or when it is given along with phenytoin, or when it is given along with digoxin, very important, or when it is given along with oral contraceptives or warfarin, or we have some other lamotrigine, or we have so many other drugs. Lamotrigine, valproate, phenytoin, digoxin, oral contraceptives, warfarin, all these drugs are narrow therapeutic in nature. When carbamazepine is given along with these drugs, what will happen? Carbamazepine is enzyme inducer. What carbamazepine does? It will immediately, or it will induce metabolism of lamotrigine. It will metabolize sodium valproate. It will metabolize phenytoin. Phenytoin was enzyme inducer. Same like phenytoin, carbamazepine also. Phenytoin, digoxin metabolism immediately occurs. Digoxin action occurs, and its action will be decreased. Oral contraceptive is given along with carbamazepine. Oral contraceptive failure can be seen. And when warfarin is given along with carbamazepine, warfarin activity decreases. So don't forget metabolism drug interactions with carbamazepine. Carbamazepine याद रख लो. car means crab GPS, induced headache. Crab in the GPS. Okay, GPS, when we are traveling in car, carbamazepine is inducing headache. It is inducing enzymes in the liver. So these are important points about carbamazepine. I think you understood about carbamazepine and oxcarbazepine. Whenever you are evaluating the prescriptions, and in that prescription if you find carbamazepine, always check these points. If patient is having adverse effects, if patient is having concomitant use of these drugs along with carbamazepine, and you can also counsel the patient. Okay, so these are important points about carbamazepine. That's it for today. Thank you.